I am here with Dr. Christie Morelli. I have the pleasure of talking to her today about Lyme disease in particular. Dr. Morelli is a licensed naturopathic physician in the state of Connecticut, and she currently works at Tau Vitality in Hebron, Connecticut. She really works to assess each patient as an individual and strives to get to the root cause of his or her unique symptoms. Her practice focuses on gastrointestinal health, skin health, and tick-borne disease, specifically acute and chronic Lyme disease. And Dr. Morelli, you had the privilege of working under Dr. Mariah Hinchey, the owner and medical director of Tau. Tell the audience here how you became so passionate about Lyme disease in the first place.
I became passionate about Lyme disease while I was in naturopathic school while doing my preceptorship. The physician I was mentoring had a patient come in who was diagnosed with chronic Lyme, and he could barely function day to day as a result of his symptoms. He lost his job, he lost his home, his independence. Many relationships fell apart, including the one with his own children. Chronic Lyme disease is not recognized in the allopathic community. He was struggling to be heard and to get the help that he needed, and he was essentially written off by his doctors as just crazy. I find that mind-boggling that any healthcare professional would just write a patient off and diminish that patient's reality just because it was something that they didn't learn in medical school. You know, he'd lost everything he had because of his illness, and still nobody believed him. That experience really opened my eyes to how underserved the Lyme community was and still is today, which is why I want to help as many people as I can that are suffering. When I was offered the position at Tau, I had the chance to work with Dr. Mariah Hinchey one-on-one on acute and chronic Lyme disease. That's an opportunity that I really couldn't pass up, as I was well aware of the growing Lyme epidemic. And also I was given a chance to learn from one of the best in the field. My background in GI and skin disorders really helps me, though, because when treating Lyme patients, many of them also present with GI and skin symptoms as well. So really the two go hand in hand.
Do you find that most of the patients coming in are presenting with Lyme?
Lyme is known as like the great imitator. It can present in so many different ways. Just the rule of thumb for at least anybody that I see, I do want to rule it out. That can be done through lab testing, but it's definitely on my list of one of the first things that I have to rule out.
Yeah, that makes a lot of sense. As you said, it's one of the fastest growing epidemics, silent epidemics that we have, not just right here in Connecticut, of course, but I would say nationally and internationally, even from what I understand.
Yeah.
Do you agree? Yeah.
Yes, 100%.
So what do you feel like Tau's treatment of Lyme disease, how is it different from something else that might be offered out there for people suffering?
Tau's treatment of Lyme disease is different because we focus on treating the whole person. Prior to beginning a Lyme herbal protocol, we check for any food sensitivities. We assess nutrient levels as well as address gastrointestinal health. We remove any pro-inflammatory foods. We address any nutrient deficiencies that we found. And we support the gut to ensure that the body is prepared to fight the infection. Once we feel a patient has established that strong foundation, we begin a focused herbal protocol. The mechanism of action of the herbs prescribed have been scientifically researched and proven to kill the Lyme-causing spirochete, support immune function, support collagen tissue, and ease disease symptoms. And then once the protocol is established, the patient has regular checkups to monitor their symptoms and progress.
Compared to like a conventional route, what normally would people have to go through to get diagnosed or treated?
The allopathic treatment of Lyme disease solely focuses on killing the Lyme-causing spirochete with antibiotics. Antibiotics are obviously very useful. However, when it comes to treating Lyme, they're just not a cure-all.
What would you say some of the biggest obstacles or challenges are in treating somebody with acute or chronic Lyme?
In my opinion, the biggest obstacle of all is just the stigma against chronic Lyme disease. Even if you just take a second to Google chronic Lyme disease, it literally says chronic Lyme disease, belief that symptoms are caused by an unproven infection. The sheer denial by the allopathic community that chronic Lyme exists creates a huge obstacle because it causes confusion amongst patients. It causes rifts between family members and friends. And it also discredits the treatment that Lyme literate doctors like Dr. Hinchey are providing their patients. With that being said, Lyme is a spirochetal infection. And then you think, what's another spirochetal infection? Oh, syphilis. So according to the CDC, if syphilis goes untreated, it may present as tertiary syphilis in 10 to 30 years after the initial infection. And that may result in damage to your internal organs and even possibly death. So how is it that unbelievable that Lyme can persist for months to years after the initial infection? And then for the sake of the people suffering from Lyme, I really hope that the allopathic community begins to recognize that chronic Lyme disease is a very real diagnosis.
So you're hopeful that might change at some point?
Oh, I definitely think as time goes on, that'll change.
But there aren't really any tests right now in terms of chronic Lyme disease, right?
Not directly, no. But so that makes it hard.
And I think that's where really looking at the individual as a whole, looking at their life story really and their health history becomes so important. You know, that functional medicine-based approach with naturopathic medicine, just getting the complete picture and being able to make that diagnosis based on the whole story.
We're not just, a heart. We're not just lungs. We're not just a liver. We're, a whole body. So how can you not take into account everything? If
somebody does suspect that they have Lyme disease, or if they're just pretty sure they do. I mean, a lot of people, of course, they get that signature bullseye rash. You have it if you get that. But if you don't have that rash and what do you recommend somebody does?
I would first, do a little research and try and find a Lyme literate physician. Make sure that you find a provider that you think will be a good fit for you. I'm sure that they'd guide you through this anyways, but definitely get some specialty diagnostic testing, such as IGeneX for Lyme disease and as well as other co-infections, because as we found out, your standard labs just aren't that accurate. Okay. You really want to push for specialty lab testing and then take it from there. But that's a good place to start to rule it out.
Like you said, finding a Lyme literate doctor.
Yeah.
And in Connecticut, I think we may have more access to that. But the good news is, we now offer at Tau telemedicine. So location doesn't matter anymore. They can make an appointment to come and see you. They suspect that they may have Lyme disease, or if they've been suffering with range of symptoms for a very long time and they're not getting any sort of answer from anywhere else, and they may want to rule that out. So if somebody wants to make an appointment to come and see you, you're taking new patients?
Just call Tau at 860-228-1287 and just ask to make an appointment with Dr. Morelli.
And there are online new patient intake forms. It's really easy. www.tauvitality.com. So the whole process, I know, is very streamlined now. What a great resource for everybody. Again, not just in Connecticut, but all over. It was great to talk to you. Is there anything else you wanted to leave our audience with or mention before we close?
No, just thank you guys for listening, and I hope to meet you.
Great. All right. Thank you, Dr. Morelli.